Organizations dealing with early childhood development in Kenya have appealed to county and national governments to remunerate community health volunteers, popularly known as CHVs, so as to encourage more people to deliver basic health prevention and promotion services to the community members. Speaking during a media sensitization workshop in Thika, the organization emphasized the integral role played by the media in informing the masses and its enormous influence on the society. Kiambu Public Health Director Teresiah Njoroge noted that the lack of information on nutrition among expectant and nursing mothers was a major setback in the growth of children under the ages of 3 years, and there was need to seek more partners to help drive the right information to as many people as possible. Rachael, Makena, the ECD Network Partnership Manager, said that the media played various important roles in the development of a child's life. Stephen Ikonya of Kenya AIDS NGOs Consortium noted with great concern that most of the international donors were transitioning, which meant that both the national and county governments needed to allocate more funds in the health sector. Ikonya noted that 80% of the budget in the health sector was donor-funded, and most of these programs ran the risk of collapsing if no money was allocated to them by the two levels of government.
My name is Teresiah Njoroge, Director Public Health. Today we had a breakfast meeting with the media because we wanted to highlight on the issues of how we can be able to address prevention of diseases instead of cure, because as a directorate we believe that prevention is better and cheaper than cure. And more so, we were able to highlight on the mandate and also the issues to do with the nutrition, because we've realized that our mothers are coming to our facility very late, and some of the interventions we may not be able to address. And we believe if at all the issues are not addressed when the baby is growing in the womb, sometimes they affect the life of the child. So we were able to talk on them on coming for ANC clinic early. We were also able to highlight the issues of adolescent, the issue of the mental health, and across all the indicators that we take as a Directorate of Public Health, because we've also realized that in the county we've been having underweight cases, and this is where, because the women maybe the young mothers are not feeding well, so we want to encourage them to come to the clinic early so that we can be able to offer the interventions that are required, including IFAS and the rest, so that we can be able to address the growing child. We do encounter cases of malnutrition, but we've realized that maybe it is ignorance, because this mother may be having the right food, like they have chicken, so they are able to have eggs, but instead of feeding the child well, maybe like now when we are growing, they have beans, but you find them selling to buy bread, which may not have all the nutrients that are required. And majority of them, they are working in the factory, so you find them leaving the kids with in the daycare and maybe with nothing. So that is why we want to highlight, so that we can be able to reach out to them with the information so that they can be able to make the right decisions. To achieve our universal health care, we have been able to train the community health volunteers. And the good thing with the community health volunteers, they are based at the household level. So they are able to address the issues that are happening at the household level. Where we require referral, they normally do referral. So we use the community health volunteers, and also to address the issue of UST, the government has also been addressing the issues of the eye care, where we've been doing screening, and our community members have been succeeding.
My name is Rachael, Makena. I'm the ECD Network Partnership Manager. We had a media team or journalist meeting where we are focusing on working with the media as an advocacy tool in our various engagements. There is also in Kiambu County, we have a project called Malezi Bora Awali Project, where we've been working for the last 2 years. On the nurturing care, we look at 5 components. We have the good health, the good nutrition, opportunities for early learning, responsive caregiving, and safety and security. Being an organization that targets children 0 to 8 years, we found that it is good to advance all those 5 components so that we can reach the child holistically. So today we are sensitizing the media, because media has a wider coverage, we are sure with if the media has the right messages, we can use media as an advocacy tool to reach those homes that we are not able to reach. During the discussions that we had, we are saying if we focus on our programs by engaging media, we'll be able to make greater impact. So today is our phase 1 of doing that. And the engagement we end today, we've seen that the media is a very key instrumental tool with the engagement that they have even shown us. We also wanted to understand the challenges that media face, because once we understand the challenges media face, we are able to know how to bridge that challenge.
My name is Stephen Ikonya, and I work for an organization that is called Kenya AIDS NGOs Consortium, KANCO. The program manager for our children programs that includes our nurturing care for early childhood program, and also child health and also immunization program. And I would say that this meeting today is very, very key. The fact that we are building the capacity of our media people to be able to go out there, number one, create awareness, and number two, be able to work together in ensuring that matters to do with children, both at the county and at the national level, are well taken care of. And that includes the fact that currently we realize that most of the donors that have been supporting us, including a donor like Gavi, they're in the process of transitioning. That is a call both to the national and the county government to be able to put more resources on the same, because the support that we were receiving from some of these donors was quite huge, and that calls for prioritization in our CIDPs, prioritization in our annual work plan as the county government, to be able to bring on board resources that would be able to take care of what some of these donors have been supporting us in. Apart from that is the issue of registrations and policies. We are seeing that most of the counties currently, they have already started supporting the community health workers. They already have a community health strategy, act and policy on board. And this is also a call to the counties that have not been able to do this. And the fact that we want to congratulate Kiambu County that they have already started the process. There's need for us to finalize on this particular act because it will go a long way in supporting our community health volunteers, who we call the community doctors, to be able even to do much more than they have been doing, and especially now that we are having most of our children malnourished because of the current drought and the issues of food insecurity, and especially in the informal settlements. So it is key, this need for us to begin to support them so that we can even have more targeted programs for them that would see to it that most of our we reduce the cases of mortality for under fives, not just that in ensuring that they visit households with information for nurturing care for early childhood development, and ensuring that per household there is what the mother or rather the caregivers have the requisite knowledge that they need for them to be able to take care of their children.